Hello and welcome to Hashtag Our Doc Talk. This is our weekly chat on COVID-19, and with us is Chief Medical Officer Seth Kaufman.
Good morning, everybody. Thanks for joining us today. A reminder about who I am. So Dr. Seth Kaufman. I'm the Chief Medical Officer here at NorthBay Healthcare. And we've been doing these weekly talks to update our community about COVID. Today's discussion is about the reopening of businesses, a very hot topic, in the country, in California, and of course in our area. First, I want to follow up on a question we had last week about whether the counts, the case numbers that we see online are positive tests, or is each, are positive tests, or do they account for multiple tests? So is it just one person, one unique person? The answer is it is one unique person. So it tells you the total amount of cases, the total amount of people who tested positive, whether they had 5 tests or 1 test. So I was pretty sure about that last week, but I wanted to double check, and that is the answer from that great question last week about the overall numbers. With that, let's start. I have a few minutes of introductory comments, and then we're going to go right into the questions. And so first, let's talk about the numbers. As of yesterday in Solano County, there are 1,064 cases. So that's about a little over 4% of the people we've tested have tested positive, 4.16%. And that is about 240 cases per 1,000, per 100,000 in our county. 240 cases per 100,000 in our county. As a comparison, Los Angeles County, which has the highest case rate in the country this week, has about 880. So we're a quarter of LA County in terms, just if you look at us per 100,000. I don't want that to sound comforting, because we're all in the same situation in terms of how to make sure we don't transmit this disease anymore, and we'll talk about that. Our hospitalization rate is, as of yesterday, was 25. All this is available on the Solano County Public Health website. That 25 is the highest hospitalization rate in a single day that we've had since the beginning of the pandemic. So in summary, we're seeing more cases. Both the tests come about positive in the clinics and the ER. We're also seeing more hospitalizations. Our death rate in Solano County is at 23, also available online. That's been the same for quite a while now. So as of this week, as of today, we're not seeing more deaths. We are definitely seeing a spike and a trend. It's not just one day in hospitalization rates and in our overall case rate. With that, some stories for you about opening businesses. I had 2 interesting experiences this week. One is my wife and I had a dine-in experience. It was outside, but we ate at a restaurant. It was really nice to sit at a restaurant, not have dishes to clean, just to order what we want. It shows you how used to we get to doing those things. But after you don't have it for a few months, gosh, it feels so nice. We wore masks when we went to the restaurant. We were very careful not to be in line waiting to get a table. The tables were all spread apart, at least 6 feet apart. The server was wearing a mask. Some of the staff were wearing gloves, some were not, but I saw hand hygiene all over the place. And we felt very safe. Another experience, I had to go to an appointment and had to go in an elevator at one point in the last week. I get in the elevator, and honestly, most of the smaller elevators I've had to be in the last few months, if I have to be in another location, has been by myself. And I think people are very good about, if it's a small enough elevator, you just kind of wait in line and get in the elevator. I get in the elevator, it's about to close, and a elderly person and I think probably her grandchild, a child, maybe a 10-year-old, get on the elevator also, right as the doors are about to close, kind of last minute. Neither are wearing masks. Neither seem to really understand any of the rules around social distancing. It was very concerning. I, of course, voiced my opinion. I'm telling you those 2 stories because the theme today is that it's not really about what you're doing, because you're going to be compliant, right? You're going to be wearing the mask. You're going to be keeping your distance. It's about what others are doing. It's all about what others are doing. And that's where it's so important to be diligent and to be looking around and providing the feedback. Because you might be really good with all your precautions, but if others are not doing the same, then it's not a safe environment. It's not a safe environment. Okay, with that, let's go into some of our questions here. We have a lot this week, and Robin, start us off.
Is there any new information on the proportion of those testing positive who are asymptomatic? It seems like those numbers are growing.
We are seeing a rise in, so the question is are we seeing a rise in the number of people that are asymptomatic and testing positive? And the answer is yes. A good portion of that is an increase in testing. So we're starting to test, we have the ability to test asymptomatic people. We have 2 state-run facilities in Solano County. You don't have to have symptoms to be tested there. So yes, we are seeing more asymptomatic, and likely a good portion of that is related to asymptomatic, an increase in testing. On that note, what we're seeing though, when we do contact investigations and tracings on the current people that are testing positive, about a third are related to family clusters. Extended family living in the same location or having an interaction with other family members and testing positive. Another third or so, the numbers are a little different than that, but around a third or so are related to workplace or other facility clusters, and then a third are unknown. And I'm saying that to you because we're now learning that because we're trying to screen and test as many people as we can, both with symptoms and without symptoms.
So we had a question sent to us in advance, and they asked, if you've tested positive, is it necessary to retest after 10 days or your symptoms are gone?
Yeah, so the question is, if you tested positive and now you're in the 10-day CDC and Solano County required isolation period, do you need to be retested? And the answer is no. So it's 10 days. For non-healthcare workers, it is 10 days from your symptom onset, and you do not need to get retested. Does that mean you don't wear a mask after that? No. Does that mean you absolutely have no ability to transmit the disease to somebody else? No. We just know from the data that the transmission risk goes way down at that 10-day mark or so. Number one. Number two, we also know you're going to wear a mask, continue to social distance, and use good hand hygiene, and so you're not spreading it, even if there's a small chance you still could.
Okay. The other question we had in advance is, if you're traveling to another state, you're
Sure.
staying within the country, but you're going to another state, will you have to quarantine for 14 days there, and then do you have to quarantine again when you come home?
Yeah, so the question is, do you need a quarantine when you're traveling between states? And the answer is it's state dependent. New York just announced yesterday that they're requiring a 14-day quarantine period for a bunch of states. It really depends on the state you're coming from and going to. Some are requiring a 14-day quarantine. Some have different types of criteria. Businesses have different criteria. If you work in a high-risk environment, and I mean by high risk, where you're interacting with people, your employer might have requirements around testing or a quarantine period. So the answer to that question is yes, it's out there. It's also out there for other countries, and you should look online. CDC has information online. You'll have to look online to see where you're traveling to and from, and look at those guidelines. They change frequently.
Okay. With things reopening, there tends to be a thought that maybe it means everything's safe now. Can you talk about, is it safe yet?
Yeah, so with things reopening, are things safe? The bigger question behind that is does the spike of cases we're seeing now, which is all over the state, California is the highest cases in the country, is it because of the reopening of businesses? And that's a tough one. When we do these contact investigations and tracing, in other words, when we trace back the person who's positive and see who possibly they have spread it to or got it from, we see that the majority, as I said a few minutes ago, are from family clusters and facility workplace clusters. The majority, not all. There's a whole third of there that we don't really know. Do we see clusters in businesses that are being compliant with the requirements? And the answer is at this stage no, but I'm not sure we have enough research yet to say for sure no. So take that with a grain of salt. I say that because hand hygiene, social distancing, and mask wearing are effective. So it is not safe to go to businesses. The restaurant that I went to last week, it's not as safe as being home. We have not seen a large cluster so far in this county from those businesses, and they're all doing their best to keep their staff safe and keep their patrons safe. So the answer is to know where you're going, really make sure that the businesses you're going to are following the rules, that you're following the rules. And I can't tell you it's as safe as being home, but if everybody's following the rules and you're being very careful, then that's the best way to move forward.
So what precautions should we be taking when going out, say, to dine or to shop or to get your hair done or whatever?
Yep. So the first thing I would recommend is looking at let's just use a restaurant, for instance. Go to the restaurant's website, see what they're talking about in regards to COVID. Are they actively talking on their website? Or call them and say, what have you done to make sure that I'll be safe when I come to your restaurant, for instance? Obviously, we want these restaurants to do well. They need to reopen. There's a healthcare impact in not reopening businesses and trying to restart the economy. All of us are desperate, as I said at the beginning, desperate to have a nice meal without having dishes at the end, or shop at a store or things like that. But the answer is to really do your best, do your due diligence, and know what's happening at that store. Are they completely compliant and following the rules? It's all there's a lot of transparency in Solano County and other counties. You can go right on the Solano County website. It explains their requirements to reopen. So it really falls into very common sense measures, mask wearing, social distancing, right? To make sure that the rounders for the clothing are spread apart, that people have room to move around each other. Are they keeping people distanced away from each other? So you should confirm that before you visit these locations, either through the website or through calling. If you know the business already, that's great. Pick wisely, do your research.
So it sounds like you're saying no matter what business you go to do kind of the same things. But are there differences in the way that, say, what you do to prepare to be safe at the grocery store versus the hair salon versus the nail salon or whatever?
Are there differences in the different kinds of businesses in terms of how you protect yourself and therefore you're protecting others? And the answer is no. So everyone should be doing maximal precautions. And I'm not going to go through them again because you know them so well. And if you just look at the different rules for the different businesses, they're all pretty similar. You can't have a nail salon and say no touching because you can't do nails that way. So of course there are differences, but that's not going to make a difference for you. If you're going to a restaurant, you're going to be wearing that mask. You're going to be very careful with social distancing. If you're going to a nail salon, you're going to be doing the same. So it's no real difference. When you get back from those businesses, you should be very careful. So they're doing their best to keep staff and you protected. You should do everything you can. So if you should do the same thing that many of us do here. Because, I need to be on site here at NorthBay Healthcare. It is people need me, and it's not a job where you can work remotely. But I have a transition. I have a kind of transition area in my home, and I can shower and change out of my work clothes without ever exposing anyone. So I think that's a reminder that should be part of this if you're out there. Especially when you're having close contact like nail salons, is don't, wash your hands. When you get home, change out of your clothes and do your best at that. And that's a way to not bring it home.
So what about personal gatherings? Can we hug our family and friends again? And should we only be going to outdoor events?
So the question is what about family gatherings and outdoor events? We are seeing the spike of cases we're seeing in Solano County is heavily related to family events and gatherings. So the answer is no, you should not be hugging your family members. That's really easy to say in my chair when I'm not part of your family. For my own family, if someone told me that, that's really hard. Like, it's been so many months. But the answer is that we're seeing a rise in cases, and you should not be touching your family members that are not part of your closed loop, that that's not already in your household. Also means that people should not be visiting, and you shouldn't be adding members to your household. If you need to, that should be a long-term plan, not people staying for a few days and then leaving. They should quarantine for a while, maybe get tested right before staying with you, and then that should be a permanent change for now. So the answer is that is a source for cases, is family gatherings, family interactions, extended family staying. So be extra diligent across the space, across the backyard. Chairs should be placed as far apart as possible in the backyard, so you can hang out and talk to each other. No sharing food. Just be extra diligent.
So grandkids and grandparents can get together, but there are some steps they should take?
Yes. So again, all of those interactions pose a risk, and I think we have a very intelligent community, and I think anybody who's listening to this knows that that's an increase in risk, right? So if you have something scheduled where a grandparent's seeing a grandkid, or you need to see family members, you're taking a risk. You've weighed out the risk and benefit, and you need to do it, right? You need to do it for your sanity, for the health of that person. I think I said in a previous session that social distancing does not mean social isolation. That it's really important for mental health that we have some interaction with our family members. Virtual, of course, is the safest, but sometimes in person is important. So with that, the answer is if you are going to do it, testing as close to interaction as possible is great. So a swab test is great. You can get antibody tested. It's not going to give you as much data. If you're going to do it really close to the interaction, swab is probably your best bet. A diagnostic swab is probably your best bet. And then quarantine yourself. Minimize any potential exposures between the testing and seeing the family, seeing each other. My only other comment about children is we're not seeing a lot of transmission amongst children, which is good because it's really hard to control children, under a certain age. So, for my 10-year-old and 12-year-old, telling them to socially distance is really hard. They're children. So I think the good news is that the data is showing that they're not necessarily transmitting it very much amongst each other. There are some cases out there, but not a lot. And when they do turn positive, it's mostly the adult giving it to the kid, and not the kid bringing it back and spreading it to the adults. But with that, absolutely testing very close to that interaction, doing it in the backyard, so, keeping yourself physically distanced at least 6 feet, things like that.
So what advice do you have for, say, businesses or churches and so forth that are reopening? What steps can they take to keep not only their staff safe, but their patrons?
Sure. Again, we already have experience with this. I wish we didn't, right? We have some churches that have had some cases. We've had workplace outbreaks, and these are really great businesses and organizations that have done everything they could. The answer is that we cannot break any of the rules that are out there around social distancing, mask wearing, and hand hygiene. And I would really encourage you not to really avoid any sort of mass gatherings. Churches are really important. They're really important for our sanity. They're really important for our beliefs, and we need and people need their services and need that community, and it's so important. Is there a way to do it in a safe way? Not indoors, staying distance, keeping the groups small, doing it virtually. Everything is going to pose an increased risk. Can we mitigate that risk by having really smart measures? So honestly, with the spike, maybe a few weeks ago I would feel differently. With the spike in cases, I'm not recommending that churches that we have mass gatherings of any form. I don't think it's good. If you have to do it, then and I have felt that way since we've reopened, that mass gatherings is a real concern. So I think if you need to do it, then do it as safely as you can. As safely as you can.
Okay. There's been talk about the virus not living on hard surfaces as long as they previously thought. Do employers need to be wiping all surfaces, and how often?
Okay. It's true that the initial data showing what we call the terminology is fomite transmission, so transmission from an inanimate object. Remember that data in the first weeks of the pandemic was hours on some surfaces, much longer on other surfaces, and we're not seeing a lot of that, but it's still possible, and it can be a source. So I cough, or I'm talking really loud like I am now, and I'm going to spread my mouth contents naturally, even when I'm not trying, on the surfaces, and those should be wiped down. So the answer is yes, on a regular basis, as frequently as possible, they should be wiped down. I think there are some more stringent criteria from the CDC. I don't have them off the top of my head. All the criteria on cleaning and things like that are, I think, a little bit of business, are specific to certain businesses and are available online on the Solano County website. But the answer is don't let that data fool you. It's still possible to have it on surfaces, and you never know if it's just a few hours on a surface. If it's a public area, a work area, you don't know. You can't see it. You don't know if someone walked by talking and singing and got something on that surface 5 minutes ago. So frequent wipe downs are still necessary. Don't change that because of the fomite transmission data.
All right. Someone is asking, I saw a posting that COVID can cause psychosis. Is that true?
No, I have not seen any data on COVID itself causing neurologic disease, including psychosis. It is a lung disease, 100% a lung disease, and actually we don't even see it heavily necessarily in the bloodstream. It's primarily a lung disease. Now, medicine is never black and white. You might have read stories of people having psychosis because any overwhelming infection in your body, as we're seeing with really sick hospitalized patients, can make you crazy. In other words, the fever and the infection itself can make people altered, confused, not acting right. So the answer is yes and no. COVID does cause COVID can cause people to be altered like any infection can, so not acting themselves. Whether they're psychosis, we think about hallucinations and delusions, totally possible. That's just because of an overwhelming infection, not because COVID itself infecting your brain. I hope that's clear. Yeah.
So there are a couple of questions kind of together here. Can you get the virus through your eyes?
Okay.
And there's stories out there about vitamin D deficiency making you more susceptible. Is that true?
Okay. So first question is can you get through your eyes? Yes. So it is a concern if it's floating in the air. Your eyes, like your mouth and nose, can be a source for absorption of the infection. It is a mucosal surface. Mucosa being that thin skin in your mouth that lets things easily transmit. That's how we get infections commonly. So it is possible. It's probably not a common way. I don't think we know of transmission, but it is possible. But again, not a common way, and would probably would require very close contact, someone not wearing a mask that's looking at you, and a prolonged exposure. I don't know the vitamin D data well enough, so the question is vitamin D deficiency cause you to be more susceptible? I don't know the vitamin D data on COVID. Those who have a weakened immune system are at risk, but I don't know the direct data on vitamin D.
Okay. Is there any proof that one blood type is testing more positive than others?
Yes, there has been some data that certain blood types are more prone to infection than others. I think we would need some more definitive data on that before we would make any recommendations. And I'm not sure what those recommendations would look like. Would we say, hey, don't worry, you have this type, so you're okay, and you have this type, you better shelter in place. It's hard to imagine. It's not going to be all or nothing. It might be some blood types are more prone. There was one study. It's not a bad study. I think the jury's out on what we would do with that, and I think it needs to be reinforced.
Okay. So there were recent headlines about new medications that can help in the treatment of COVID-19, and what can you tell me about that?
We're really encouraged. So let's see. The best data right now is on remdesivir. We use it here at NorthBay Healthcare. It is on short supply around the world, so it's not just being given to anyone. There's certain criteria we use, and we've had really good outcomes with it. We're really proud over all of our care here at NorthBay. We've had unbelievable outcomes, a lot of really heroic efforts to save patients who were very close to dying. So a lot of great efforts. Remdesivir has really been one of our mainstays for medication therapy. In recent weeks, dexamethasone came out, very encouraging. The beauty of that medication is that it is easy to administer. It does have some side effects, but it has less than many other medications that are being looked at right now, and we are starting to use it. I would say that the data on dexamethasone, a steroid, is not necessarily a slam dunk at this stage. But so when we think of putting patients on medications, doctors and nurses, it's always the same discussion. What are the risks and what are the benefits? So we are using dexamethasone. Other systems are too. We're very selective. We're trying to be careful with it and waiting for more data to come out that hopefully will continue to support the use of it. A reminder that some studies come out one week and say it works, and then next week comes out and says it doesn't work. The good news is with dexamethasone, the steroid, is that we already use it for so many things that we know the side effects well, we know the impact, so we feel safe using it in certain patients. One caveat about dexamethasone is that it comes in an oral form and an IV form. And so some of you might be saying, oh my God, does this mean we're going to have a pill that we can give to each other and prescribe? Which right now there is nothing. Hydrochloroquine was our hope, right? But it's not showing benefit. And the answer is no, not yet. The dexamethasone studies were on sicker patients requiring that the dexamethasone studies that showed benefit, right? They looked at a bunch of different groups. At this stage, is the IV form being given in patients who require oxygen. So this is not the person who's at home, fairly healthy but probably feels crummy, but doesn't require a hospital stay with oxygen. Dexamethasone has not been shown this week to show benefit for that group. I would love to see a pill that has shown benefit. Diagnosing COVID-19 in the ER that I do every week now, and telling people, well, you're safe to go home and there's no real therapy is not a fun conversation. So I would love to see some effective medications that are safe and that can be given as a pill and that shorten the course or shorten the ability to transmit it to others. We are waiting for that as we also wait for the vaccination.
So as we were speaking about cleaning surfaces and so forth, they've heard that it's necessary to clean with EPA-approved cleaners to kill it. Is that accurate? That's a good question. So the question is do you need to use an EPA-approved cleaner to clean surfaces? And the answer is that it's a fairly it's not a very resilient virus. It's spreading like wildfire, but it doesn't require. We have bacteria and viruses that are much harder to clean at North Bay and others in the world, not just North Bay. All systems and everybody has the same bugs and they're hard to clean. This particular virus is not a tough virus to kill. We know that the antibacterial the average antibacterial medication that has at least the percentage of alcohol that's required, and I think it's 60, but don't quote me on that, is effective. So the answer is that your regularly approved antibacterial hand washes and wipes should be okay. I don't know the specific data on EPA being required. I would, if it's a business, I would refer you to the guidelines on reopening. If you're at home, I would say the standard antibacterial medications are effective. Okay. that is the list of questions we have. If you want to talk about next week.
Yeah, so thanks for joining us today. Next week we're going to go on a little hiatus. It's the holidays, and so we will not be here at 10 a.m. next Thursday, but we'll be resuming the week after July 4th. Have a wonderful and safe holiday. Thanks for joining.
Thank you.